the physiology of color vision and how do we perceive colors. So let's start first by to summarize what are the contents of this lecture. We will have first some short introduction about the physiology of color vision. Then we will go through the theories of color vision and how different scientists through the previous 200 years explained the physiology of the color and how do we perceive it. And then we will go through more deep understanding of the neurophysiology of color vision. And here we come to the fun part, which is color blindness and what are the different syndrome or different manifestations of color blindness. And finally, as we used to, we need to know how to test. So we will go through the different tests that are used for or are invented to test for the color vision. So let's start. What is the color vision? You can see some things are red. This font you can see it like blue, and you can see this font as white in a black background. So did you wonder one time how do you see the colors, or how do you perceive the colors? This is what this lecture is about. The now or the most accepted concept now that the color is a function of wavelength. So as we said in the very few slides in the optics, in the first 2 or 3 slides of the optics, when we were discussing the electromagnetic spectrum, we said that we have what's called the visible spectrum, in which we see different colors starting from the short wavelength for the blue color to the long wavelength for the red color. So it was accepted that the color is a function of the wavelength. So we can see this as red color because it sends impulses of longer wavelength to your eyes. You can see this as a white color, or this sentence in white color, because it sends impulses of a fusion of different wavelengths of whole visible spectrum that are collectively will give this white color. So which part of the retina exactly will perceive the color? As we said yesterday, it is the function of the cones. So the cones have some visual pigments. These visual pigments are sensitive to changes in color. And this will be better appreciated in the photopic conditions, so we can see the colors more clearly during the day rather than the night. So, as we said before, that what we can see is the visible spectrum ranging from the about 350 for the violet color to 700, which is for the wavelength for the red color. This is what we can see. And the presence, or if we can see any colored object, this means that this object will emit a light wave of a specific wavelength. This wavelength, what will make us see the color in this grade. So the origin of the colors is a breaking down of light into spectral constituents created by the prism. As you see, the prism has the property of dispersion, so it will the white light when it enter into the prism, it will be dispersed into the spectral components. And we can say that also the white light is the addition of different wavelengths together. So if we add the red to orange to yellow to green to blue to the violet together, this will result in the white light. So the monochromatic light is a colored light of a single wavelength, and the white light will be the addition of different colors. So you don't have to memorize which color has which the wavelength, but this is just to illustrate the differences in wavelength between the different colors as to prove that the color is a function of the wavelength. Dr. Soham, we already started. Can't you hear the lecture or can't you see the lecture? Okay, so let's have some basic information about the colors. So this is an introduction to know what are the different colors, what are the relations between the different colors, and what are the terms or the physical terms used to describe colors. We have what's called the primary colors. These primary colors are representative of the small and medium and long wavelength. So the red color and the green color and the blue color, these are the colors which are considered the primary colors. The red will be representative of the longer wavelength, the green will be the middle wavelength, and the blue will be for the short wavelength. If we add these primary colors together, so if they are mixed, they will give the white color. So this is called additive mixing. Additive mixing means that if we have light of blue, light of red, light of green, and we add them together will give the result of the addition of these three colors will give the white color. And this what happens like in the cinema. If you are sitting in the cinema, you will see that there are projectors that will project into the screen, and the screen will show different colors. These colors are just an additive mixing of the basic primary colors. There is another form of mixing color, it's called the subtractive. The subtractive, if we subtract the primary colors, or if these three colors are mixed, but in this case it is not light, but they are pigment. So if we mix the red and the blue and yellow pigments together, the resultant will be the black color. So the black color will be the result of subtractive color mixing, and in this case we are not mixing light, but we are mixing pigments. So to summarize, the color perception is a function of mixing of both lights that can be added, which is additive mixing, forming the white light in the middle, or that lights are absorbed. So these absorbed are formed by the pigments. So if we are mixing paints or mixing pigments, the function or the resulting will be the subtractive mixing, result in this black color. There is another group of colors that is called the secondary colors. The secondary colors are basically the mix of primary colors. So if we mix the red and the green and blue, there will be three colors result, or the magenta, the yellow, the cyan will result due to the mixing of two colors together. So if we mix the red and the green, result yellow, the green and the blue result cyan, the red and the blue will result in magenta. These are called the secondary colors. And of course, if we mix the three, the white will be the result. There is another group of colors that are called complementary colors. Complementary colors mean that these colors are totally antagonizing. So the yellow and purple are called complementary colors. The red and the green are called complementary colors. The orange and the blue are called complementary colors. This means that, what does it mean by meaning antagonizing? This means that they are totally different in the spectrum. So there is nothing called reddish green, or there is nothing called greenish red, and although there is nothing called yellowish violet, there is nothing called bluish orange. So these colors are totally antagonizing, and they are opposite each other in the this color circle. So they are called complementary colors. We will need this later on. Okay, so if after we identify the different colors, we need to how to describe the color. What are the physical characters of chromatic stimulus? Chromatic stimulus meaning that if a stimulus that has a chromatic appearance or a color. So this chromatic stimulus or this colored stimulus can be described in three terms. The first one is called the hue. The second one called the saturation. The third one is called the brightness. So which one or what is meant by each one of them? The hue is basically the degree of the color, which is a function of the wavelength. So this color is called green, and its hue is also called green. This color is called red, and its hue also is called red. So just the hue is just a synonym to the wavelength. It is just a paraphrasing for the wavelength. So different wavelengths of light will result in different colors, as we know. For the short wavelengths, it will give the bluish colors, while the longer wavelength, it will give more toward the red colors. So this is the hue. The second thing is called the saturation or the purity. So this means that how much is the color is pure, or how much is the degree of freedom from light of other wavelengths. So if the color is much more is very pure, or if it is not mixed with any other color, then this color is called saturated. But if we add other colors like gray, like here, so the color is decreasing in saturation because we added another color of wavelength, which is the gray, until the color become totally unsaturated. So the color now is not pure, as there is another color which is adding up to this color. Here again, the red, this is called the saturation or the saturated red color. But as we increase the addition of another color of wavelength, this will result in unsaturated red color. So it is the degree of freedom from mixture with the light of other wavelengths, and the monochromatic light is added to the green and red will make them less saturated. The third term is called the brightness or the intensity. So the brightness or intensity is a term that will reflect how much light is coming from this color. So how much the color is illuminated. It is a term for the luminosity. How much is the color is showing a very bright, or how much the color is appearing bright and intense. So for this blue color, if we increase the brightness, this will lead to eventually the color will appear whitish, because here the color appear what's called washed out. So washed out means that the color appear more pale, and due to increased luminosity coming from it. But if we decrease the intensity, eventually the light will become black. So the black, or the black here was called by decreasing light coming from the color. So the brightness and intensity is the quantity of light coming from the object. Blue color with variable levels of intensity, as you can see here. So once it is increased or decreased, this color or the blue color appear more washed out. Another physical phenomenon that will describe the colors is called the Purkinje phenomenon that we mentioned about yesterday. We said that there is a change in the color sensitivity of the cones and rods, or the change of the color sensitivity of the photoreceptors as we shift from the night to day or from day to night. Meaning that when we are in the daylight, there will be more sensitivity of the longer wavelength, while in the night the eyes become more sensitive to the shorter wavelength. So for example, here we have more sensitivity to the longer wavelength in the day, in the morning, so we can see this red color with this bright red. But as we go to the night, there will be decreasing sensitivity of our eyes to this red color, as it is a longer wavelength. And during the night, we can see it in the shades of gray, because the rods now are more sensitive and the cones are not functioning. So the eyes now is shifting, or the shift of the sensitivity of the eye during the dark is occurred due to decreased cone function, because the cones are not working in the night. So we took this example yesterday. We say that if we look at this figure during day, we can see that the yellowish and the green, or specifically the red, the red appear more bright, as we are seeing in the photopic condition, so the cones are much more sensitive. But if we look to the same figure at night, we can see that the colors of shorter wavelength becoming more bright. And we said that during night, this yellowish green appear more bright during night because the rods become more sensitive to this color, and which is around 500 nanometer, and that's why the road traffic signs are more in the yellowish color. So this was just a quick introduction about the color vision. Let's now talk about the theories of color vision. What are the theories that explain the color vision? This was started by like 300 ago by Isaac Newton. Isaac Newton, or the Newton theory, so since who discovered the gravity, he also proposed a theory about perception of color. So this color, or this theory, that the colors is only vibrations in the optic nerve. So there is the color, the red color will produce some vibrations in the optic nerve. The orange color will produce another form of vibrations in the optic nerve. So you may laugh now and say, "Oh, this is very naive, and this theory doesn't even is not even acceptable to a young child." But this was his potentials at that time, and there is no other methods for experimental knowledge at that time. So he only describes theories by observation. Then later on, another theory formed by two scientists who are Thomas Young and Helmholtz. So Thomas Young and Helmholtz, these names are not strange to us. We heard their names in a specific device in the optics. Do you recall it? Do you remember what did Young and Helmholtz invented in the optics? Yes, exactly, Dr. Iman. It is keratometer. So young Helmholtz didn't only invent the keratometer, but also they supposed, or they proposed a theory for the explanation of color vision. So they said that there is what's called a trichromatic theory, or the theory that has three colors. What are these three colors? This theory suggests simply that we have three types of cones. We have what's called red cones, and the green cones, and the blue cones. Each one of them contain a specific visual pigment. This visual pigment doesn't have a green color, or a red color, or a blue color, but they are just sensitive to a specific wavelength. So they have maximum sensitivity for a specific wavelength, which correspond to the pure red, and the pure green, and the pure blue color. So the blue cones have some visual pigments respond to the short wavelength. The green cones have visual pigments which respond to the medium wavelength. The red color have visual pigments that respond to the longer wavelength. And they propose that we have what's called different spectral sensitivity. So the shorter wavelength, or the blue cones respond to a shorter wavelength of about 420. The medium will be about 440. The long will be about 560. And the sensitivity is in a form of a curve. This curve is a bell shape, meaning that it has a maximum sensitivity at a specific number, but it can also be stimulated by different wavelengths, but to a lesser extent. So the red cones can be stimulated by a wavelength of about 660, but to a lesser extent. They are maximally stimulated at 560, but they can be still stimulated by other wavelengths. They can even be stimulated by shorter wavelengths, like 420, but to a lesser extent. So in order to perceive colors, there are our photoreceptors are stimulated in different percentages, or in different ratios, and that's what will make the mix of the color, so that we can sense that the color is mixed. So we have the red sensitive cones, that these cones will be sensitive for the longer wavelength. They have a visual pigment called the erythrolabe and respond maximally to a wavelength of 565 nanometer. The green sensitive cones have the chlorolabe visual pigment, which respond to the light of medium wavelength and respond maximally at the wavelength of 535 nanometer. Finally, we have the blue sensitive cones, which have the cyanolabe visual pigment, which respond to shorter wavelength, which respond maximally at 440 nanometer. And if we stimulate different combinations of these three types of cones, this will result in different colors. So we can see the yellow color by equal stimulation of the red and the green. We can see the cyan by stimulation of the green and the blue cones. We can see the white by stimulation of the red and the green and the blue cones. So this was the first theory or the first acceptable theory to explain the color vision. And then another theory formed by another scientist, which is called Hering, which is this theory called the opponent theory. Hering also made another theory or another law in physiology that we will talk about the next week, which is called the Hering law of equal innervation for the extraocular muscles. But we will talk now about the opponent theory by Hering. So Hering said that the cone or the photoreceptors are linked together to form three color pairs, either the blue-yellow, red and green, and black and white. So according to Hering, if we wanted to feel the red color, we have to suppress the green. If we want to see the white color, we have to suppress the black. If we want to see the blue color, we have to suppress the yellow, because these are complementary colors. So according to Hering, that there is no what's called reddish green, or there is no greenish red. So you cannot see the red and the green in the same time. You cannot see the black and white in the same times. These are called opponent colors. Opponent colors that they cannot be perceived at the same times. So according to Hering, we have the different combination of the photoreceptors. There are photoreceptors which receive the yellow and blue. There are photoreceptors which receive the red and the green. There are photoreceptors that will receive the black and white. And there is if we have a red stimulus, this stimulus will stimulate this group of cone, causing stimulation of the red and inhibition of the green. If there is a white stimulus, this will go to the black and white gates or the black and white photoreceptors, stimulating. If it's a black, then it will inhibit the white and stimulate the black. So this is called the opponent theory by Hering. It is now the most accepted theory that both theories are correct, but they are just on different levels, meaning that the trichromatic theory can explain the color vision at the level of the photoreceptors. So the trichromatic theory will explain that we have green cones and we have blue cones and we have red cones. So they will receive the blue color or green color or the yellow color, or the green or blue or the red color. And the opponent theory can be used for explanation of the neural processing of the color, meaning that after the color is perceived by the cone, or the red cone or the green cone, then with the neural processing through the level of bipolar cells and the ganglion cells, this will be governed by the opponent theory. So the red color or the red cone will be connected to a red-green bipolar cells that will allow the red impulse to pass and will stop the green in order to be seen as reddish. For the black and white, it will be the stimulation of the all photoreceptors will give the whitish color, so that it will undergo the black and white gates or the black and white bipolar cells and the ganglion cells, stimulating the white and inhibiting the black. So this will explain the color theory at the level of bipolar and ganglion cells, or the further neural processing of color. So here is what I'm saying about if we have a stimulation of blue cones or the green cones or the red cones. So at the receptor stage, this can be explained by the trichromatic theory. So we have three types of cones. Every one of them is sensitive to a specific wavelength. But once they are perceived, they will, in the neural stage, when they will undergo neural processing in the bipolar cells or in the ganglion cells, they will pass through some gates. There is a red-green gate, there is a blue-yellow gate, there is a black and white gate. That will, and different stimulation and inhibitions of these gates will control the intensity and the brightness of the color. So after we talk about the theories of color vision, let's now discuss the neurophysiology of color vision. So what is how is the color processed? You will see that the color there is nothing much more different from what we mentioned yesterday. So if you have a good understanding of yesterday's lecture, you will have also a much more better understanding of today's lecture. So it was well understood the process of bleaching and regeneration of rhodopsin, as it is the visual pigment present in the rods. So it was proposed that the same thing occur with the cones. So if there is a red, if there is a white color, or if there is a light in the dark, this will cause bleaching of the rhodopsin and regeneration of rhodopsin. So the same thing occur with the color cones, but it occur in the day. So under the day condition, the colored light strikes the retina, and then this will produce local potential at the photoreceptors. So if there is a red color, this will cause a stimulation of the red cones, leading to electrical current in the red cones, and this electrical current will be transferred from the photoreceptors to the bipolar cells. The same thing with the blue light, the same thing with the green light. They will perceived by their corresponding photoreceptors according to the wavelength, and will be processed causing bleaching of these pigments, leading to their decomposition and stimulation of electrical current. And this electrical current will be passing through the bipolar cells and other neural cells in the retina. Then they will reach to the bipolar and horizontal cells. And here we can, the neural processing here can be also explained by the theory that we mentioned yesterday of the center surround. So we can say that when the red color is passing through stimulating the red cones, and then emit an electrical impulse, this electrical impulse will pass to the bipolar cell. The bipolar cells now have the same center surround organization. So this, since it is a red color, it will pass through the bipolar, which has a red center and the green surround. So they will cause stimulation of the center and inhibition of the surround, so causing depolarization of the center, leading to stimulation of the red, the on of bipolar, which has a red color, causing passing or causing stimulation of this depolarization of these bipolar cells, will cause transmission of the impulses to the ganglion cells. The horizontal cells have a role. We said yesterday that the horizontal cells control the lateral inhibition. So we can say the same thing about the color vision. In such a condition, the lateral inhibition will control the luminosity or control the brightness of the image or brightness of the color. So if the horizontal cells are much more stimulated, they can cause the color to be washed out. Or if it is not stimulated, it can cause that the intensity of light appears clear or bright or intense. So the horizontal cells can control the degree of color or intensity of color, or the amount of illumination coming from the color. Then after this, after bipolar and horizontal cells, then it will stimulate the ganglion cells. And which type of ganglion cells? We said yesterday that it is X cells. The X cells are the type of ganglion cells present in the retina that will respond to the color vision. Then after this, the fibers from the X cells will relay in the parvocellular. So from layer 3 to layer 6 are the cells in, or the layers in the lateral geniculate body that will respond to color vision. Then it will pass to the cortex. So which layer in the cortex? Also we said yesterday, it is layer 4C. So the layer 4C in the striate cortex, or area 17, is the layer that receives the most input from the lateral geniculate body, and the color itself will also relay in this layer. And then the color will pass to the blobs at layer 2 and layer 3, and also in the area 17. Then it will pass into the secondary visual cortex, or the visual association area 18 and 19, specifically to the lingual and fusiform gyri in the occipital lobe to be perceived. So this is the journey of the color vision, starting from first striking the retina, to the photoreceptors, to the bipolar and horizontal, to the ganglion cells, to the lateral geniculate body, to the area 17 in the cerebral cortex, and layer 2, starting from layer 4, then layer 2 and layer 3, then it will project to the secondary visual cortex, and finally to relay or to be perceived by the lingual and fusiform gyri in the occipital lobe. Okay, so is everything clear up till now? Okay, let's now talk about more clinical or more clinically related issue, which is the color blindness. So the color blindness is inability to see colors, and this is can be termed or the term for color blindness called the daltonism. Daltonism meaning that it is a person who have inability to see the colors. So we have two grades or two types of color blindness. It is either that the either perception is defective, or we cannot see the colors clearly and brightly as normal individual, and this is called anomaly or anomalous color perception. Or if the color perception is completely absent, or we cannot see the color altogether, this is called anopia. So again, if there is a problem of the cones that can see the color, this is called anomalous, that the cone is not functioning well, but they have some grades of or some degree of function. But if the cones are not functioning at all, then this is called anopia. And this can be either congenital or acquired, or the color blindness can be congenital or acquired. Let's see what is the classification of color blindness. As we said, the color blindness can be either congenital or acquired. So we will leave the acquired now, and we'll talk about the congenital. So the congenital can be divided into two main categories. The first is achromatopsia. Achromatopsia meaning that we cannot see the whole colors, or there is a single photoreceptor which is functioning. Achromatopsia again, this means that A meaning there's absent, chroma colors, opsia vision. So there is absent color vision, or there is a dyschromatopsia. So we can see color vision, but this color vision is abnormal, or there is a dysfunction in the color vision. The achromatopsia can further subdivide into the rod monochromacy or rod monochromatism or cone monochromatism. It's worth mentioning that achromatopsia, it is a rare anomaly. So it is a very rare anomaly, meaning that we have only a single photoreceptor which is functioning. Rod monochromacy meaning that that we have the complete absence of cones or complete malfunction of cones. So the cones are not working, and this person have the red and the green and the blue cones are not functioning. So this person will see the world in shades of gray. The monochromacy can also be considered, or the co-monochromacy can be also considered as a true color blindness, because this person can see the whole world in a single color. He hasn't green or blue cones functioning, then he can see the world in blue and red color only. So he is also colorblind. The discs can be divided into the dichromacy and the trichromacy. So what is the difference between them? Dichromacy meaning that we have a single cone or a problem with a single cone. So this patient can see with two cones and only two cones. This can be either protanopia or deuteranopia or tritanopia. Protanopia meaning that this patient doesn't have red cones, so he can see only the green and blue. The deuteranopia meaning that the patient does not have the green cones or they are not functioning at all. As we said, opia meaning that the complete absence of function. So he can see only the red and the blue. Tritanopia, which is the most rare, is the patient cannot see the blue, so he can see only the red and the green. So that's why it's called dichromacy, because di meaning two, chromacy color, so he can see only two colors. Trichromacy meaning that the patient can see the three colors. So where is the problem? The problem is that there is a single color which is not functioning very well. So there is some anomaly in this function or in this cone. It can be further divided into protanomaly and the deuteranomaly and the tritonomaly. Protanomaly meaning that the patient who can see the blue and the green very well, and there is a defect in the red cones. This defect is not complete defect, so there is no complete absence of the red cones, but they are not functioning very well. That the patient who has the red and the blue cones functioning well, but the green cones are moderately functioning. The patient who have well, but the blue is like washed out, or they don't see the blue color very clear. So this is an outline of the different diseases related to the color blindness. Let's now go to the more details. First of all, what is acquired color blindness? Acquired color blindness is a person who is born with normal color vision, but due to some disease in the retina or the optic nerve, this will result in decreased visual acuity or scotoma, central or paracentral scotoma, and defect in the color vision. And it is known that usually the patient who have retinal lesions such as a central serous chorioretinopathy or macular edema will present with the blue-yellow deficiency, since that the blue and yellow cones are present more abundant in the macula. And also, on the other hand, the red and the green deficiency are more common with the optic nerve lesion, such as optic neuritis or optic nerve compression. So if you want to test for the lesion in the optic nerve, like optic neuritis or optic nerve disease, like compression, like in thyroid eye disease, we test with the red-green color, because the optic nerve is much more sensitive to the red color deficiency. And we have some exception. Let me just share them with you. Maybe you may be asked in the exam about them. Almost all the macular disease or the retinal disease can cause blue-yellow deficiency, except a disease called the Stargardt disease. So the Stargardt disease, this is the commonest macular dystrophy. This will cause red-green color deficiency. And all optic nerve lesions can cause red-green deficiency except glaucoma, as it is an optic nerve disease, but it will actually, the glaucoma will affect the retinal nerve fiber layer, so it will cause blue-yellow deficiency, and what is called the autosomal dominant hereditary optic atrophy. This also will cause blue-yellow. So this is called the acquired color blindness. Let's now talk about the congenital color blindness. So the congenital color blindness, it is not uncommon. It is an X-linked disease. This X-linked recessive disorder affects males more than females, so it is more common to be seen in males. Like about 3 to 4% of population will have some grade of color blindness. This can be, as we said, either achromatopsia, which can be further subdivided into rod monochromatism, in which there is a pathological lesion affecting the cones, so the patient doesn't have any color discrimination. They cannot see any color. They see the world in gray color. And it was found that these patients, usually their vision range about 660. They have nystagmus, they have normal fundus, so you will not see any abnormality in the fundus since they have malfunctioning cones, but they will have a different or an anomalous electrophysiology, as we will see in the next lecture. Sorry, in the next week. So here is the scene as viewed by normal individual, but the patient who have rod monochromatism will see only the gray color. Another form which is also rare for achromatopsia is the cone monochromatism. So there is absence of one cone, like for the two cones. So the patient has only single cone functioning. Like for example, if he has only the red color, then he will see only the red color whatsoever. He can see only nothing but red his entire life. But the visual acuity, since they have cones functioning, so they have some cones in the fovea and the macula are functioning, so it was found that these patients will do better in the visual acuity testing. They will see 612 or better. Now, the more common is the dyschromatopsia, in which the patient can see two colors, and the third color will be either defective or either it is absent or defective. So the first one is called the dichromacy. In the dichromacy, the patient has absence of one of the three cones. So he has only, there may be absence of red cones, there may be absence of the blue cones, there may be absence of the green cones. So the patient can see only by two types of cones, and this will account for about 25% of color in defective individuals. They will be, this 25% are evenly distributed between protanopia and deuteranopia. So the color loss of the red color and the color loss of the green color are very, very common, while the color loss for the blue is very rare. So here is the normal color, and here is what our normal individual. And here what is the scene viewed by the protanope. So he cannot see the red color, so this red color cannot be seen, and this and this and this. So he has deficiency in the red cones. And this is the deuteranopia. The patient cannot see the green color. Check this green color, check this green color. The patient cannot perceive it. And this is the tritanope. The patient cannot see the blue color. Look at the blue part of the sky. So it will be a grade of color between the red and the green, as the patient has only red and the green color functioning. So this is also a nice photo showing the normal, and there is the protanopia, the deuteranopia, the tritanopia. How does every one of them can see, and also the monochromacy. How does the monochromacy or the monochromatic patient can see only in gray color in the typical, or sometimes there may be some functioning cones giving some atypical monochromacy. Again, this is the normal C. And this is the patient who have red-green blindness. So he cannot see the red, he cannot see the green. This is how can he actually see. Again, this is the normal, this is the red-green, how does he see. So this is just, this is the dichromacy. For the trichromacy, will be see very minimal grades of the red and the blue and the green color. So here the patient, if has a low red or low green or low blue, if he has some functioning or some function of the red and the blue and the green cones. This will cause some defect in the color vision, and this defect is not very great in order to cause total loss of the color, but it will be just balanced. And that's why some of these patients, even they don't discover that they have a problem. So if you compare between the normal color and the defective color, sometimes there is not much big difference. That's why the color blinding or color blindness is prevalent. It will like about 4%. This is not a few percentage for an ophthalmic disease, because many of them even are not discovered. Finally, we will talk about the tests for color vision. So the first one who discovered, or one of the main tests for the color vision, are Ishihara test. Who is Ishihara? Ishihara is an ophthalmologist, and he was an officer in the army, specifically in the Japanese army. So he was asked to do a simple test, and a simple rapid screening test, in order to screen soldiers for their military service. So he invented what's called the Ishihara test, and it has been used since then. This test is made of different cards. These cards have different numbers formed by different sized dots and different colors with a background. So the patient is asked to identify the number, and if there is any color defect, then it could be detected by the failure of patient to perceive the number. So it has different plates, and these plates there are some screening plates. Like the first one, there are some plates for illiterate patients who cannot recognize numbers, so that they can pass their finger across the line. There are other two plates for identification of the color defects, like 5 and like 6. I'm not continue, so that you can identify if you have color blindness. So that you can the patient can see which or the examiner can detect if the patient cannot see the color present in the plate. So the plates have even different functions. So for the first plate, it is usually for demonstration and for malingers. So even the malingers or even the color blind will be able to see the number in the first plate. Then from the second to the ninth plate are seen by patient or by normal individual who have normal color. But if the patient has some deficiency in the color vision, they will fail to respond correctly to the test. Then from the plate number 10 to the plate number 17, the plates there is a number seen by the color normal, but they cannot seen again by the color deficient subject. They will just test the different types of color blindness. And then from the 18th to the 21st plate, there will be a hidden digit plate. So here is in this plate, there will be a hidden digit. If the patient is normal, if the individual is normal, he will not see any figure here. But if he has color vision deficient, will be able to see a figure here. So this is not, if you can see or if a patient can see a figure here, then this means that the patient is colorblind. From the 22 to the 25th plate, they are diagnostic plates. They are seen by the normal subjects, and the colored vision deficient, one number will be more easily than the other. So they will have different configuration or different colors of the both numbers. So for example, in this plate, the protons who have deficiency in the red color will see the number on the right side, while the deuterans that have deficiency in the green will see the number on the left side. So if he is normal individual, he will say, okay, it is a 26. If he has protanopia, he will say it's 6. If he has deuteranopia, he will say it is 2. So this is the Ishihara plates, and it will be a test for color blindness, so to see if there is a normal vision. So this is the protanopia and deuteranopia. will not be able to recognize any figure in the plate. But the problem here is that the tritanopia, the patient who have tritanopia, they will perceive the color, although it is not the same color as perceived by the normal, but they will still be able to perceive a color or recognize a number. And that's why, in case of the deuteranopia, this is one of the drawbacks of the test. Sorry, for the tritanopia. The tritanopia cannot be diagnosed by this test. So the results, if the patient see most of the plates, then he is normal. If 13 or less are correctly read, then the patient has red-green color blindness. And the 22 to the 25 are used for detection of protanopia and deuteranopia, but it cannot see the tritanopia and doesn't grade the degree of deficiency. So it cannot, or the main disadvantage is that it cannot diagnose the tritanopia, or it cannot say how much color deficiency does the patient have. So this is the first test. This test is made on or based on the picking. So we need to, or the patient pick a number, and this is the same principle for the second test, which is called the City University Color Vision Test. In this test, the patient is presented plates. These plates have four colors in 4 color plates and a central one, and the patient is asked to match the central color to the surrounding 4 colors. So as you can see that this test is very crude test, as it will diagnose only the moderate and severe color deficiency, because there is no grading of the color deficiency here. It will be only to ask the patient to match the closest color to the central one. This is called the City University. So it is again a picking test. The Farnsworth-Munsell 100 hue test is a more effective and a more accurate test, in which the patient will be presented the four racks like this. Every rack of them will have about color chips. There are about 85 color chips. These color chips, the patient will be asked to arrange them in order of increasing or decreasing the color, so that these are the yellowish or the bluish or the greenish. The patient should arrange these plates or arrange these chips in order of increasing the color or increasing the defect or increasing the intensity of the color, so it will be more accurate. And then there will be like this graph. It is made and will determine if the patient failed to arrange the color, the green or the red or the blue, so that we can know if the patient has deuteranopia or tritanopia or protanopia. There is another form of this from this test in abridged form or in a more short form. It's called again the Farnsworth-Munsell, but it is 15 hue test. The D15 hue test, meaning that we only arrange 15 color chips, or there is only 15 caps. These 15 caps are arranged in order of the hue or in order of the color perceived by the patient, so that it is used for screening, and it will not cause much more much accuracy like the full version, which is the 100 test. The gold standard for diagnosis of color vision defects is called the Nagel's anomaliscope. The Nagel's anomaliscope is a device, as you can see here, that looks like a microscope. So the patient looks from this eyepiece, and he will find this. You will find a circle that is divided by a horizontal line. The lower one will be like yellow, for example, and this yellow color have 590 nanometer, so this is called the test field. And the patient has some knobs that he can scroll in order to mix two colors like the green and red. So he will mix these colors in this mixture field, and he can see his result in this mixture field until he find or he mix up these two colors till he reach the yellow color that he can see in the test field. So since this test depends on very accurate numbers like the wavelength of these colors, so we can know exactly how much the patient has color deficiency. So this is very, very sensitive as we mix two colors of known wavelengths until the patient reach a final result of known wavelength to match it with a test field which also has a known wavelength. Finally, the lantern test, or this is another test which is used for screening and used for identification if the patient has any problem with color. So a lantern is placed to the patient which has some light sources, and these light sources have different colors, and the patient just is asked to identify the colors of the window. This test is useful for some patients who have some occupations which requires identification of colors, like pilots, like traffic men, like drivers. So these occupations may require this lantern test in order to recognize if the patient can see the red and the green or not. So does anyone have any question in this last part? So I guess it is an easy lecture. Okay, thank you very much. So we know who is this, and this is Mark Zuckerberg, the inventor and the owner of Facebook. You may wonder why did he choose to make the Facebook in the blue color? You may guess now. Okay, he has red-green deficiency. So Mark Zuckerberg, yeah, he has red-green blindness. And that's why he make the Facebook in the blue color, and that's why we are stuck with this color.